Hello, my name is Hannah Walker, and today I'm going to be talking to you about something that has been an unfortunate part of my life since I was 13 years old, and that is a pneumothorax. A pneumothorax is the medical term for a collapsed lung. When a lung collapses, air leaves the lung and fills up the space between the lung and the chest cavity. There are two types of pneumothoraxes, tension and simple, and those are usually due to like a lung laceration, any kind of trauma to the chest, drug abuse, cigarette smoking, or certain lung conditions. In some cases, a lung will collapse on its own without any apparent injury or reason, and that's called a spontaneous pneumothorax. That is unfortunately my condition. My lungs have balloon-like tissue called blebs. And here's my lung when they were actually doing my most recent surgery. As you can see, here's a large bleb, smaller ones here, old scar tissue where the lung has torn away. Smaller blebs are right here. And over this way, here's a large piece of the old scar tissue. When a bleb gives out and pops, it causes the lung to gradually deflate. There are two types of surgical procedures to repair pneumothoraxes and spontaneous pneumothoraxes. The first one is a thoracotomy. That is where the surgeon makes a 6-inch incision, usually underneath the shoulder blade, in between two ribs, and in some cases a rib may or may not need to be removed. Then fluid and or lung tissue is then removed. The second procedure is VATS, or video-assisted thoracoscopic surgery. It's a microscopic surgery used by inserting a small video camera into a patient's chest wall via like 2 to 3 small incisions. Both surgeries involve a pleurodesis. Pleurodesis is pretty much just a chemical burn using talc powder or betadine. And it roughs up the lung, it has a chemical reaction to your body, and it makes your whole lung surface rough enough so that it can adhere like glue back to the chest wall. And in theory, it's not supposed to be able to collapse again. But unfortunately, in my case, I have the blebs, and so they can grow back, and any negative pressure that I do, such as heavy lifting, coughing, sneezing, anything like that, it can cause one of those blebs to give out, and then result my lung collapses again. In conclusion, I hope that this information that I've shared with you today has been somewhat insightful, helpful, and I hope that you now better understand my condition and just the role it has played in my life. Thank you.